Should people with ADHD be taking iron supplements? Iron is one of the most common elements in the crust of the earth. It's number 4, making about 5% of the crust of the earth. It's the most common element in earth overall, but it's a tiny component of our body, only about 5 grams of iron. The average American is weighing more than 75 kilograms, so that's 75,000 grams. 5 is a tiny piece of that. And most of that iron is bound up in heme for hemoglobin, myoglobin, and certain enzymes. In the body and in the brain, non-heme iron is essential for making myelin sheaths that insulate the axons in the brain. It's important for the synthesis of dopamine and norepinephrine. So tyrosine hydroxylase requires iron to work properly, and it's involved in other cellular processes as well. So there are a number of studies finding lower levels of iron in the body, usually measured by ferritin levels, not just free iron. So lower levels, particularly in the bloodstream, but a few studies have looked in the brain as well. And there are studies showing that supplementation with iron supplements can reduce some ADHD symptoms. It's also been shown people with low iron stores in part of their basal ganglia, those are where dopamine and norepinephrine neurons project to the frontal cortex, may have less benefit from stimulants. So again, in those cases, if iron is really low, supplementation may help. But there are risks to supplementation. So you can have too much iron, and there's, particularly at the end of life, studies showing almost the opposite, and that is too much iron in your basal ganglia, too much accumulation of iron over time is associated with higher rates of dementia, higher rates of executive function and cognitive function decline. Don't just jump to iron supplementation. Try to sort out with your doctor whether it's reasonable for you.